takes motivation, right? The reason that the LARCs are the initials for long-acting reversible contraceptives. Those are the implantable rods, like, Implanon, the rods, and they have Implanon, they have Nexplanon, but it's the rods that are implanted in the like arm here.
Mhm.
And then of course we have the IUDs. So there's the ones that are embedded. There's no such thing as a progesterone IUD. They're called It's called levonorgestrel. People call them, well, you can have a progesterone IUD. There is no progesterone in a single IUD that exists on the market today. It's a progestin, it's levonorgestrel. Now, the reason I mentioned this is that these are very popular. And then there's the copper IUD, of course. Now, just as a quick overview, the levonorgestrel IUDs come in multiple strength. The most common is the one that's the name brand is Mirena, that can last inside, like for 8 years, you can use it and keep it in place. And the reason is that the amount of levonorgestrel inside embedded in the IUD is very high. During the first year or more, it's so high that it gets absorbed systemically quite significantly and can actually shut down ovulation. You get systemic levels. So it's definitely given in a way that it gets all over. So it actually has warnings on the box of, if you get it, it'll have on the package, insert and so on for depression, for acne. That's because it's absorbed. Okay. And so it's important to understand it's not just a local effect, at least for the first year or two. And then as you dissipate the amount, it goes down. The copper IUD creates a lot of localized inflammation. That's one of its mechanisms, but it also creates inflammation in the cervix, and it also increases the risk of catching vaginal infections. And it doesn't protect against sexually transmitted diseases. None of them do, of course, but even less so, okay? It makes you more vulnerable. And as well, there have been many cases now reported that when it's removed, the copper IUD arms, one or both of the arms, break off when you're trying to remove it, that instead of the arms are opened up so they go out like this, they're like this when you put it in, and then you release the sheath and then they go out. And then it's supposed to flex up to pull it out, right? Because otherwise you can't get it out through the cervix, So what happens when people pull on it, instead of the arms like flexing up like this to get it out, they break off. They break off, and then you have to have a surgical procedure to go in and fish around and find them and remove them. And that's actually a real thing associated with the longer it's been in. And then the implantables have a lot of breakthrough bleeding and a lot of other, potential unpleasant side effects. But those are super popular because you don't have to think about them, because they're put in and they're there for like 3 years for this, and then, 10 years or 12 years now for the copper IUD, 8 years for Mirena. That's why they're very popular. The opposite is true for the ones that are the safest. There, you have to use them on an as-use basis. So they're only used when you have sex. So in other words, unlike the long-acting things where they're put in and then you never think about contraceptives for years because it's embedded in you in some form. These take active, conscious decision-making that you're going to use a condom, you're going to put in a diaphragm, you're going to put in a spermicide or a Phexi, which is like an acid that changes the pH. You have to do it every time you have sexual intercourse, or it will do you no good. Now, if used just as you're supposed to, these are very effective methods. They're very effective. The reason they get a bad rap is people don't always use them. And that's why we have two ways of measuring effectiveness with a contraceptive. One is called use effectiveness. The other is called theoretical effectiveness. Theoretical means you use it perfectly every time. Okay. Use effectiveness is how is it really used in the real world? So condoms, if used perfectly every time, is at least 98% effective. However, if not used at all or used improperly, it drops use effectiveness, like it's like real world use, is 80% because people just don't do it. Okay. And that's true for pretty much all these barrier methods. That's what they're called, barrier methods. Now, if you use two barrier methods, like say you use a diaphragm and a condom, and the diaphragm can be put in up to 2 hours before sex. The condom is really last minute. Okay. But if you use both of them, you're at least as good as a birth control pill, which also has a different use effectiveness because sometimes people forget to take the
Yeah.
pills, right? And that's good. That's why the LARC, the long acting reversible contraceptives, are so popular now in the gynecological world because it doesn't rely on doing anything on a daily basis, right?
Yeah.
The shots, which I'm not even going to like, the Depo-Provera shots have really fallen out of favor because they're associated with, well, osteoporosis. That's pretty bad. And it's really, they're very poor choice because medroxyprogesterone acetate is a known carcinogen and it's bad for your cardiovascular system. All of the progestins actually will reduce vascular health by blocking the production of nitric oxide. And just as a quick mention, the other birth control pill, progestin, is a derivative of spironolactone. It's called drospirenone, and it's in that's what's in birth control pills called the branded name Yaz and Yasmin.
Mhm.
Okay, and the progestin only pill called Slind. That one does not derive from testosterone. So it's more like real progesterone. Okay. So it's actually somewhat beneficial as a standalone. That's why it can be used as Slind, as standalone, because it doesn't have all that testosterone-like effect. So that's it's like more like an anti-testosterone. So that's why, just as a mention of that one. Now, in terms of the best are are the ones that you use on a day-to-day use whenever you have sex. So it would be condoms, a diaphragm, um, then there's Phexi, which is, like I mentioned, it makes the environment too acid for sperm to live. Sperm like an alkaline environment, not
Mhm.
overly acid, and it will just knock them out. And then, of course, there are sperm direct killers, like sort of like pesticides. There's spermicides that can be used, and all diaphragms, which is like a barrier ring, need to be used with a spermicide because those little sperm are so sneaky, they can slip right next to the diaphragm through that little space. So that's why you have to add in the spermicide. And especially if you use two of those barrier methods at the same time, you have phenomenal good birth control. And of course, you can use Plan B or similar as a backup if there's some accident that could happen, with other things too. No method is foolproof. I mean,
No.
actually, people have had abdominal pregnancies after hysterectomy, rarely, fortunately. But, even I've had many, not many, but, considering I've been in practice a long time, I've seen quite a few pregnancies after a tubal ligation, which is a sterilization procedure. Those little sperm and eggs, they'll like buck the odds sometimes to get together and create an embryo. But it's anything that you can do that doesn't change your hormones would be a preferred option. Hormones are life. Hormones are a gift for us. That's why when women lose them, they should mourn their loss of their hormones. And
Yeah.
yet we spend, many women, decades of their life getting rid of their beautiful hormones. We love our hormones. That's why if I had to rank them, if you wanted something long acting and reversible, even though there are some negatives, I mean, everything has some negatives, I would go with the copper IUD I would go with that over the progestin IUDs with the levonorgestrel. But if you do want a progestin one, get the one that has the smallest lifespan, like Skyla, and or Kalina, the ones that are shorter than you have to replace them more often because the amount of the levonorgestrel is less. I would take one that I had to replace more often that
Mhm.
has less of the levonorgestrel because you'll have less absorption systemically. And then you might even be able to maintain ovarian function, which you don't have. Over half of women on the Mirena IUD stop ovulating. So you're
Mm.
not going to have normal hormones. You don't let them trick you and think it's not going to do that. But you'll have less of that. And we have very little data on the smaller dosed IUDs with the levonorgestrel. Nobody's doing data collection or studies.
Mm.
Nobody wants to know. But it would be intuitive that if it's a lower dose, it's going to be less absorbed because we know the longer the Mirena is in, the less systemic levels you'll achieve. So I would go with the shorter lifespan um, levonorgestrel IUDs or the copper IUD if you need something that's long acting. If you feel you want a birth control pill, then, and this is off label, but I would use the Slind, which is the drospirenone, not the testosterone type of the progestin, and then you can actually give back bioidentical topical transdermal estradiol. Because remember, the estradiol has nothing to do with the contraceptive efficacy
Right.
of an oral contraceptive. And you could actually do that, give back estradiol transdermally along with the Slind, which is the drospirenone derived from spironolactone progestin. And if you have to do such things because you're in college or you're a non-responsible, poorly responsible high school student, I mean, I don't want unwanted, unplanned pregnancies. Then for the shortest time that you have to, you go on one of these more, we'll say, safer methods. Safer because you don't have safer not in terms of body health, but safer if you think of body health as preventing pregnancy. Okay. And that you're not going to get less likely to get pregnant, and you don't have to remember to do something every single time, and you're not dependent on the guy to do something like use a condom, that you have to like beg him every time if because he just won't do it, and you don't want to dump him for whatever reason. Because to me, if he won't help and do his part, then he's not a good partner. But that's my opinion.
Yeah.
And and you really want something that you're in total control. And then I would try to you use the smallest dose levonorgestrel IUD or the copper IUD or the Slind with added back estradiol topically. And, I don't want unwanted pregnancies. I'm sure you all know that you can have fun without intercourse, right?
Yeah, well, the one thing I wanted to bring up that's just a no-brainer is, do we really want to be put on a pill or hormones that are going to kill our libido for the rest of our life? And the goal is to have a libido and have a sex drive and enjoyment from intercourse. That's what we're trying to prevent the pregnancy from, but later on in life, it may be hindered because of what we're doing with our hormones.
Yeah, that's why I agree. I say the shortest amount of time until you become responsible,
Yeah,
okay, and
yeah,
can actually insist on the guy using a condom. I know they're old fashioned, but they do work. I fit diaphragms all the time. I hate to think it's a lost skill. It's not that hard to pick up. And, and if you do Phexxi, there's no, some of the stuff is the Phexxi is kind of pricey. That's part of the problem too. But condoms are very non-obtrusive in that they're very thin. Some of them that are actually marketed as enhancers of sexual
right,
response, and
right.
they're like you're going to feel better, like it's going to make things even more like upbeat and so on. So, don't pan condoms at all. They're not like your great grandfather's condoms.